Case formulation in existential humanistic therapy is based on a model that Dr. Heatherlyn, Cleare-Hoffman, and I developed. Our inspiration for this was both students and practitioners. With students, in particular, what we were concerned about is a lot of students had to do a case formulation as part of their comprehensive examinations, and there wasn't a model out there. So we had students come to us saying that they had not passed their case formulation and comprehensive exams because of this, and others that were afraid to use it because they did not feel like there was enough information out there about how to do it. Other students were having difficulty advocating for using this approach in practicum, internship, and postdoc settings because there wasn't a more developed approach. Practitioners were having difficulty advocating within agency settings and with third-party payers, such as insurance companies, because again, there was an approach, and that approach with some structure was necessary in order to demonstrate that it's being practiced consistent with evidence-based practice. So in this book, we both develop a model for case formulation, but we also develop an approach for how we can use this model to demonstrate that it's being practiced consistent with evidence-based practice. This is done through using it in conjunction with another book that came out, The Evidence-Based Foundations of Existential-Humanistic Therapy. These two books can work together to really provide that demonstration and provide a model for how, as time goes on, the therapist can continue to engage the literature to further demonstrate that existential humanistic therapy can be practiced consistent with evidence-based practice. We started the development of this approach by doing some research. We conducted some surveys with existential humanistic therapists about what were the major influences both on practice and theory. And then we asked them what were the major themes that they looked for in existential humanistic therapy, and what were the primary existential humanistic stances or interventions that they used. From this, we were able to derive a basic framework for the case formulation and treatment plan, and also for identifying what are the major EH interventions. Now, we often talk about EH therapy as a techniqueless approach, and that is justified depending upon how we define techniques. But there are stances, interventions, or strategies that we use that sometimes are consistent with what often is thought of techniques, and oftentimes are more of a fluid process there. So as we look to identify these, we looked at what people said were the interventions they were doing, but then we also looked to the major influential theorists, and in their books, what did they talk about as the primary interventions? From these two sources, we were able to derive a categorization of existential humanistic interventions, which is not something that's really been done before, but is something that's really useful when we start talking about case formulation. Now, within this approach then, what we try to do is develop a bit of a compromise between what more generalist or mainstream approaches might expect and what existential humanistic therapy might typically do, and what clients want when they're seeking out therapy. So there is a balance between the structure and the fluidity there. That was one of our biggest challenges, and that's one of the reasons why existential humanistic therapists typically have a skewed case formulation and treatment planning, is because it's too rigid, it's too structured, and that takes away from that fluidity of the EH approach that is client-centered and follows the client where they're at. So this can provide that balance through giving some structure and problem identification, including looking at it through the client's perspective, a more objective perspective, and when needed, a diagnostic perspective. Now, our research really showed that most EH therapists prefer not to diagnose unless it's in the benefit of the client. And sometimes it is in the benefit of the client. And there's a much deeper further discussion about when it is a benefit to the client, how to determine that, and how to talk with the client about that. But what we were able to do is develop a model where we could use different approaches to problem identification, including using the case formulation as problem identification, as Lucy Johnstone has talked about in her important article on this. Then we developed a way of looking at primary themes. Some of these are generalist themes that should be considered across theoretical orientations, such as client strengths, family consideration, work considerations, etc. But then we also look at EH particular themes in there and talk about how we can begin to look at those. When we get to the treatment planning, again, what we see is a little bit of a compromise there, where we can have the more traditional treatment planning, we can have the treatment plans that are expected by a lot of agencies, third-party payers, and insurance companies, but also a place to look at what the client wants and look how this evolves over time. And with that, then we can start to plug in both EH interventions as well as integrative interventions. So part of what this book does also is building from a lot of Schneider's work on existential integrative therapy. This provides a bit of a way that we can use case formulation as a foundation to do integrative work through looking at specific EH interventions, but also looking at what are other interventions that we may need to integrate because of expectations of agencies, third-party payers, or because of the particular situation of the client. Then building from that, we can see this thread that can come through and should come through from problem identification through the case formulation to treatment plan and the interventions that are part of that, both EH specific and integrative interventions. And from there, then we can use the evidence-based practice book and other literature on research outcomes and adaptation to individual differences to demonstrate that we're practicing consistent with EH therapy. Now, another thing that we sought to do with this book is provide a foundation to be able to do research on EH therapy. In the evidence-based practice book that I referred to, that was co-edited with Veronica Lack and myself, there we took a process approach to evidence-based practice, which we believe is a better fit and better foundation for looking at the research foundations of existential humanistic therapy. Now, for evidence-based practice, we also need the consideration adaptation for individual and cultural differences and general competencies, particularly general competencies through an EH lens, if we're talking about existential humanistic therapy. So while we want to focus on that process outcome from an EH approach and advocate for that in particular, there also is a place for doing outcome research on EH therapy. That's been difficult to do because of the lack of structure of a model before, but now this provides enough of a structure to be able to do some outcome research. So I really invite dissertation students and researchers interested in EH therapy to look at this model and think about how might you be able to do some outcome research with different groups on EH therapy, which further establishes that evidence-based foundation that has been established in the book by Veronica Lack and myself. So I do hope that you'll take a look at this book. If you're an EH practitioner or researcher, there is a lot from this that we're working to build from. This really had a strong political agenda with the book because we wanted to design in a way where people could use it, particularly in conjunction with the evidence-based practice book, to advocate for the place of existential humanistic therapy in agencies, in private practice, and training settings, as well as other places.